1 in 10 Americans has diabetes. 1 in 3 Americans has pre-diabetes. And even more than that have what I would consider pre-diabetes. And none of these are problems that we want. This is something we all need to take seriously. Yeah, I'm looking at you.
Huh?
I am Dr. James Munro, and today I'd like to talk about diabetes and blood sugar. We'll go through some definitions, we'll talk about how sugar gets into the bloodstream, and then what it's doing once it gets there. And if you stick around to the end of the video, I'll talk about how to address and prevent blood sugar issues. Diabetes is a chronic elevation of sugar in the blood. So the system goes like this. We eat and our blood sugar increases. And then sugar circulates through our bloodstream until at some point it is grabbed by an insulin molecule and pushed into a cell that needs it. You might have heard of the 2 different types of diabetes, so we'll break those down really quick. Diabetes type 1 is an autoimmune condition that stops our body from producing insulin. So we don't have the insulin we need to grab the sugar and push it into the cell. Diabetes type 2 is a little bit different because we actually have the insulin in our bloodstream, and sometimes too much insulin, but it's not very good at actually grabbing the sugar and pushing it inside the cell. This is something referred to as insulin resistance, and we'll talk a little bit more about this in a minute. There are a couple ways that we look for blood sugar issues, and one is really simple. We just measure the sugar that's in the bloodstream. This one comes along with some limitations because our blood sugar is fluctuating all day, every day. So we can definitely identify the major blood sugar issues with this test, but some of the more subtle issues could be missed. The other way we measure for blood sugar issues is something called hemoglobin A1C. And this one's a little bit more complicated, but it's a really nice measurement because it's much more stable than blood glucose. As sugar circulates through the bloodstream, it attaches to things, it grabs onto stuff. And one of the things it grabs onto is the hemoglobin in a red blood cell. So hemoglobin A1C is essentially a red blood cell that has a sugar molecule attached to it. Hemoglobin A1C is reported as a percentage. So if your hemoglobin A1C is 5.1, that means 5.1% of your red blood cells have sugar molecules attached to it. Once a sugar attaches to the red blood cell, they remain attached for the life of the red blood cell. And since a red blood cell lives for about 4 months, hemoglobin A1C represents the 4-month average of blood sugar levels. Unlike blood sugar levels, hemoglobin A1C doesn't fluctuate very much on a daily basis. Any changes that happen with the levels of hemoglobin A1C happen really slowly, and this is why it's a more reliable diagnostic marker. It's normal and healthy and completely necessary to have sugar in the blood at all times, and that sugar is always going to be attaching to things. So we'll always have some hemoglobin A1C in our bloodstream, and we'll always have some sugar in our bloodstream. The problems come along when it's too much. Our blood sugar levels should never exceed 200 milligrams per deciliter. That's definitely a red flag. If we're fasting, the normal range is anything below 100 milligrams per deciliter. For hemoglobin A1C, 6.5 or above is considered diabetic. Anything between 5.7 and 6.5 is falling into that pre-diabetic range. There's also research demonstrating that any levels above 5.2 are actually having detrimental effects on our health. And there are a lot of people that have hemoglobin A1C above 5.2 that don't think they have any issues at all. Too much sugar in the blood causes a ton of inflammation, so this on its own is a really huge problem. But the bigger issue is actually that hemoglobin A1C. I told you that as sugar circulates through the bloodstream, it's grabbing onto things and attaching to things. Hemoglobin A1C just happens to be the thing that we're measuring, but it's grabbing onto other stuff too. It's kind of like if you were trying to see how clean your house is and you wipe your finger on the table and there's dust on the table, well, you can assume there's dust everywhere else too, not just on the table. We'll focus on hemoglobin A1C to illustrate the problem here. Okay, remember what hemoglobin A1C actually is. It's a red blood cell that has a sugar molecule attached to it. This is a problem for a few reasons. One, a hemoglobin A1C molecule is big. We have plenty of blood vessels in our body that are the width of one red blood cell. So that means if we have a red blood cell that has something attached to it, it ain't gonna fit. The other problem here is not only is that structure really big, but the sugar molecule that is attached to the red blood cell is a crystalline, sharp molecule. It's basically scraping the blood vessels from the inside. And this is the biggest problem with too much sugar in the blood, or hemoglobin A1C levels above 5.2. Our small blood vessels are taking some hits. Elevated blood sugar is damaging all the blood vessels in our body. But the areas in our body that have really small blood vessels, they're getting hit the hardest. The eyes, the heart, the kidney, the fingers and toes, the nerves, gentlemen, your penis. This can ultimately lead to blindness, kidney failure, heart attack, numbness in your fingers and toes, loss of circulation to your fingers and toes, which can lead to amputation, and it can kill you. Elevated blood sugar issues don't have to cause those dramatic consequences. They can also cause some subtle issues, like depression, anxiety, insomnia, fatigue, aches and pains, diarrhea, constipation, acid reflux, weight gain, chronic infection, also erectile dysfunction. As a side note, if you ever want to get a guy to take a health condition seriously, all you have to do is explain how it negatively affects their penis. Hopefully by now, I've convinced you that we absolutely need to keep our blood sugar levels in check. There are a lot of ways to manage blood sugar, and I'll go through some of my favorite nutrients and herbs in a minute. But to start with, the most effective way to manage blood sugar is also the most annoying thing that a doctor can say: diet and exercise. When it comes to diet, avoiding processed sugars and candies and cakes and all that stuff is really important, but there's a little bit more to think about than just that. The glycemic index is a rating given to all of the foods that we eat, and it's a measure of how fast our body turns that food into sugar. The scale goes from 0 to 100, and sugar is 100, the highest we can go. Anything below 55 would be considered a low glycemic index food. But it's even more complicated than that, because there are a lot of things that can actually impact the glycemic index of any given food. A very ripe banana, for example, has a higher glycemic index than a less ripe, or like a greener banana. On top of that, whatever else we're eating is also impacting the glycemic index too. So a very ripe banana on an empty stomach will really increase our blood sugar. But a less ripe or a more green banana combined with a high protein, high fat snack will be much lower on the glycemic index. It's pretty easy to find the glycemic index of any given food. So if you're ever unsure about it, you can just look it up. And we also have to be strategic with the way we're eating these higher glycemic index foods. High glycemic index doesn't necessarily mean unhealthy, it just means it impacts your blood sugar. So you can eat some of these foods, just be strategic about it. Don't have a high sugar snack on an empty stomach, have a high sugar snack after a nice healthy protein-rich meal. To understand how exercise works, we need to talk about insulin resistance for a second. So remember, insulin, its job is to take sugar from the bloodstream and push it into the cells that need it. Someone that has insulin resistance, their insulin will grab maybe one sugar molecule and feebly shove it into the cell. Where in a more normal situation, the insulin really doesn't have any trouble grabbing that sugar and throwing it into the cell. When we exercise, the cells in our body have an increased need for that sugar. And to compensate, the cells will help the insulin to bring the sugar into the cell. So when we're exercising, it's not just grabbing one sugar and putting it into the cell, it's grabbing armloads and shoving it into the cell. The cool thing about this is that you don't have to go to a CrossFit gym and power it out for an entire hour to get this effect. Any body movement is helpful here. One of the best things you can do is go for a 15 to 20 minute walk after meals. That's it. One of my favorite supplements for blood sugar management is alpha-lipoic acid. It can help by increasing insulin sensitivity, so it helps the insulin grab more sugar and put it into the cell. But also, as an antioxidant, it can help protect against that end damage that can occur when there's too much sugar in the blood. I also like to utilize berberine, gymnema, chromium, cinnamon, and fiber supplements. But I am not your doctor, so if you want to try any of these things, make sure you talk to your doctor first, especially if you're taking any other medications. So that's it. Maybe talk to your doctor about some supplements, be strategic about the way you're eating, and go for a 15 to 20 minute walk after meals. For the guys out there watching, do it for your penis. I hope you're great, but I hope tomorrow is even better.